Knock, knock, knock. Perform hand hygiene. Provide patient privacy. Hi, it's me again, Maya, the student nurse at Chaffey College. I want to verify your name, date of birth. Okay, check the armband, the chart. Yes, I remember you, Mrs. X. The doctor had scheduled you today to have your Foley catheter removed. So we're going to go ahead and do that today. So I have all my supplies here, which is a drape or a towel in case there's any dribbling with the removal of the Foley catheter, the sterile water syringe to extract the 10 ml from the balloon, some normal clean gloves, and a canister or urinal to obtain the urine from the Foley catheter bag. So I'm going to go ahead and I'm going to don my clean gloves. Okay, so you can either do it one or two ways. You can lower the, or not lower, but you can elevate the bed, and you can begin removing the Foley catheter and take it to the restroom with you where you would extract the urine from, or you can kneel down and obtain the urine that way. And in this case, that's what I'm going to do. I'm going to kneel down, keeping the bed at its original position to gather it there. So I will take the canister, which I will obtain the urine, being sure that I unclamp the green handles and being sure that it's clamped before placing down like so. Now being sure to unclamp the silver clamp here, letting it drain. And you may have to make a few trips depending on the amount of urine. Okay. Clamp it closed. Secure it once again in that port or designated secured area. You want to make sure that you note the amount of urine, the odor, if any, the color, and the clarity before disposing in the restroom, resident's restroom. Okay, so we're going to, after disposal, we're going to deglove, perform hand hygiene. We're going to don another set of gloves so that we can begin the procedure. And it is a clean procedure, not a sterile, so we can just have the clean gloves. Okay, Mrs. X, I'm going to raise the entire bed to accommodate my height. Okay, and I'm going to lift up your blanket here. Okay, and if you can frog position for me, just as we did before, perfect. Okay, that tape is still in place and secure to prevent the tugging. So now I'm going to have my towel or drape handy just in case there's any dribbling when we release the tubing. And then I'll have my syringe. Okay, so I'm going to go ahead and apply the syringe to the port. And I'm going to gradually let gravity naturally pull on that so that the natural flow can go through without causing any trauma or injury to that area. And sometimes it can take a minute or so. Do you have any visitors today? Oh, your daughter's coming. That's great. She'll be happy to see you. Okay. We're at 8 ml. Being sure that all 10 mLs is in that. Okay, it's completed. Perfect. Let's remove that. dispose of that. And we're going to take the drape and we're going to gently remove it, okay? On the count of 3. 1, 2, 3. Take a deep breath. I'm going to pull that out. Catching any dribbling that may happen. And you want to take the Foley catheter. Let's cover you up. Go ahead and put your legs down. There we go. And we're going to make sure that there is no blood captured in the urinary bag, which will indicate we need to dispose of it in a biohazard bin. If we don't indicate any blood or anything like that, then we can just toss it in the regular trash bin. Toss that. The glove. Perform hand hygiene. Okay, perfect. So then we're going to document again the amount of the urine, the clarity of the urine, the odor, if any, and we're going to note how the resident tolerated the procedure. Alrighty, we're going to put the bed back to its original position. Great, and that's it. There's your call light, and let us know if you need anything.